Welcome, everybody, to episode 35 of PT Shop Talk. On today's episode, we talk about vestibular therapy, all the things that make our patients dizzy, and we finish up with our top 5 video games of our youth. So, games we played 18 and under that we really loved. I'm Casey Hansen, and with me, as always, is Nick Blitz 99 Doling and Jeremy Golden Gun Van Klompenberg. Welcome, gentlemen.
Welcome, Casey.
Welcome.
Yes, today's episode brought to you by a new tequila I'm trying today. They actually
Is
don't.
it Casamigos?
No, Código. I don't know how to pronounce it.
I'm at a loss.
Yeah. I don't. I like tequila. I drink lots of it, as people that see on YouTube know. This is a Rosa Blanco.
Oh, Rosa Blanco.
Yeah. So here's to that. If any tequila would love to actually sponsor me, go right ahead. You gotta give her a little sipper.
What up, Suarez? What are you guys up to?
Good. Yeah. Well, I'll take it. I'll do Durango if they want to throw money my way.
Durango.
No, you wouldn't.
That Rosa Blanco's got a kick.
We need some of that. We need some of that Casamigos Terramana money.
Terramana, yeah.
Is that where it's at?
Yeah.
Jeremy, I see you. I see you got your Vikes gear on, huh? A
Let's
total
go.
dub. Total dub.
JJ?
Nick, tell us how it went. You went to the game, right?
Yes.
That's the thing you did.
Yes. Got to recoup my birthday gift from back in April. So
Let's go.
Michelle got us 4 tickets to the Vikes game. Was originally supposed to be at Lambeau, but when we saw the schedule and it was like Lambeau games, New Year's Eve, or New Year's Day, we're like, there's a lot of risk involved in that between weather and just not knowing how the season's going to turn out. Because I don't know about you guys. Have you ever been to a game, like a Vikings game or KC? The Bison are never bad, but let's just pretend late season, there's no playoffs anymore. That's a crappy environment. That's a very flat environment. Very much the opposite of the one that I sat in on 3:30 Sunday, because that was lit, electric, everything.
Lit.
Fake snow just pumping in. It was amazing.
Yeah, my first season ticket wise, the Bison were like 3-8 that year, so I do know how it's like. So
yeah,
it is flat, like I say.
Started from the bottom.
We went to a game back in 2011 because we bought tickets early on, and it was like late November. Vikings were playing the Raiders. Raiders were terrible. We were terrible, and it was just boring as sin. It was just like literally leaving about halfway through the third quarter because the game doesn't matter to anybody, and like, well, I got to drive back to Marshall and I got to work tomorrow. So
yeah, like a quarter full or less stadium is brutal for sure.
Yeah.
I mean, that year NDSU was 3-8. I think attendance was 2,000 or 3,000. I mean, out of 18. It's pretty quiet. Now, you guys, so when you get 4 seats, you just got 2 extras for your shoulders. Is that correct?
Yes, that's kind of what. No, I brought Connor and brought my father-in-law Dougie, and had just an amazing time.
Yeah,
Did you get a softball-sized cheese curd?
No, I did not, because I was so into the game.
Damn it, Nick.
I didn't go and hit up concessions nearly as much as I have in the past. I got some
Connor with. What do you send him off? He doesn't know.
Yeah, but he was into it too. I mean,
put a little
high fives were
tag on him
and skull chanting, and I mean, it was awesome. We went to a game a few years back where we lost, got the doors blown out of us by Buffalo, and it's just like you need to get up and roam around a lot more, and then you can really taste test the concessions. But this time I got some sweet Nashville hot chicken tenders to start out with, though. That was a big shout out to whatever stand that was.
The Nashville chicken tender stand. Was that like a saucy tender or like a dry rubby?
Dry rub. Oh, it was so good. With a sweet sauce and a basket of fries. It kind of carried me through. It was very, very nice. That, and I always, whenever I go there, I try to get one local craft beer to kind of kick off, and then take it easy with some Miller Lights. So
what was the craft tequila scene there?
I don't know. They have a couple really big bars there. Who knows?
Yeah, I like that. Yeah, speaking of wings, chicken wings have gotten prohibitively expensive, I feel like.
Mhm.
You guys try the cauliflower wings, like at Wild Wings? Delicious. Holy moly.
They're so good.
Yeah, that's like a game
we've
changer.
made
I don't know
some
if I'll go
at
back
home,
to
yeah.
normal wings.
Dude,
they're not the same as normal. Let's pull back a little bit here.
They might be better, Nick. I don't know.
dude, and they're
Weird though. You're eating grapefruits like whole and bananas whole.
Yeah, I'm eating cauliflowers whole. I wish they just do one whole head.
And I've seen your
Bread it
hamburger
and
list.
dip it.
Your hamburger list. Yeah.
But those are more expensive than the actual wings.
Not
Those are
anymore. It's
they're
like $10
$11
for more. Yeah, but you get 20, 30 pieces of cauliflower in there.
Because nobody likes it
Whoa.
cauliflower as much as chicken.
Yeah, you must have got like the end of the night stuff where they're like, we got to get rid of all this cauliflower.
If I'm gonna be honest,
Absolutely.
I've gotten it a few times and it's always been phenomenal, Jeremy.
Well,
Maybe
I'm not
maybe you got a
dogging
bad.
No, I get it too, but I didn't get such a hearty help. You just got like, is this like a little basket?
Maybe things are different in your neck of the woods.
They probably are.
Like Nick said, nobody eats vegetables here, so when you order it, they're like, "Oh, might as well load them up."
Nobody eats this shit. There we go. Pile it up, big boy.
Yeah, this dude looks hungry.
Someone finally ordered these.
That dude seems super pissed about the like $3 per wing price on our list now. So
yeah,
placate him, please.
Yeah.
Well, I don't know. I don't disagree. I don't dislike them. I actually honestly enjoy them quite well. They're just not the real deal, my friend.
Yeah.
I like them. They're my thing. They're my jam currently. I'm sure I'll eventually get to eat them, but
you could dig them out of the garbage, much like a trash panda does.
Oh,
aka raccoons.
Yeah, that's also been in the news lately. My hometown just made at least the statewide news, right? I don't know if it went national, but some gal in my hometown brought a raccoon into the bar. She thought that would be fun for everybody.
As one does in North Dakota.
Apparently she was politely asked to leave and just said, "No, this is a small town. I don't listen to the bartender." And then just brought the raccoon around, showed it off to all her friends, and that little guy apparently potentially has rabies now. So they are trying to get everybody in the old bar to make sure you get tested. Rabies ain't no joke.
The 10 people that were in the saloon at the time.
Yeah, I read that article. KBLY News all over it.
Yeah, that is a interesting deal. I've seen some weird things. That's definitely probably the weirdest animal I've seen brought into a bar, though. Raccoon. I've heard of people with pet raccoons, but
that's something that would be on Marty and McGee. You ever listen to that on ESPN radio on Saturday mornings? They always have the section. They always have the section where it's like, it's usually people out of Florida, to be honest, like people doing stupid things. It's usually really, really concentrated to the South. No offense to any listeners in that geographic area.
I think our geographics down there are pretty mild.
But I think that would make the list. They just decided to bring a raccoon. Not a big deal.
They've been raising it for like 3 months, apparently. But you talk about like the South and these weird stories. I tell Dr. Doling this today, and he has his own raccoon story. I'm like, what is going on?
Well, I mean, it's not really so much mine.
But it's from your hometown.
Yeah.
This isn't. I was not at the bar when this raccoon was there either, to clarify.
Well, that's what's kind of ironic. We're both well past our prime in our communities. We grew up in Maddock, me, Carrington, and yet apparently they needed our level heads to make good decisions there because the Carrington Cardinal wrestling team back in 2011 did also stop on their way to the regional wrestling tournament to pick up what they thought was a dead raccoon for the sake of health. And lo and behold, that coon was still alive and kicking and caused some trouble. Caused our coach to lose his job. The team had to forfeit after, I think they wrestled the first duel and then maybe had to forfeit out once the word got out. And people were freaking about rabies. So
yeah, that's crazy.
Also, what?
We're gonna make a fine hat out of this.
Yes.
You guys, this will go right in the trophy case with our championship trophy. Yeah, that's interesting. I wonder what the technique to pick the raccoon up was. Like,
I don't know.
throw a bag on it, scoop it up with something. You think you just
Oh,
grab that sucker with your
I
hand?
just
I
hope
guarantee
I hope
there
there
was-
was a glove involved.
No way. There was a kid that went up to that thing. You know, there was a kid on that team that just went and picked it up. You guys had that guy on your football team.
Yeah, I actually know who it was. I remember knowing who it was. Yeah.
But again, at some point an adult was involved. You think
Get a sweet
he'd
pair
be
of gloves
like,
for these.
hey, put the latex gloves on we use for like blood cleanup on at least.
Yeah,
You
you'd
know?
hope, but I don't think discretion's the wiser part of valor or whatever. I don't know. But
Yeah, it's interesting. I also like that the raccoon was like, just play dead.
playing
Like,
possum.
yeah, right. He's like, I've seen my
That
cousins
silly
do
raccoon.
and then they throw him in,
It's
and he's
not
like,
that hard,
"Freedom!"
fellas.
Oh my gosh. Isn't that wild that this stuff happened in North Dakota? Two
Yeah.
separate places, and they're where
40
we're
minutes
from.
for each other. Yeah, that's the raccoon capital of America, apparently.
I have a feeling that those are not the only two raccoon stories that happen in North Dakota.
Yeah, the
Those are
odds
not
are very high.
Those
Yeah.
are not isolated events.
Yeah.
Oh yeah, I believe there was some kids in my high school that picked a dead raccoon off the side of the road, actually dead, and threw it in one of the back of one of our teachers' vehicles, like a pickup with like a cigarette in its mouth and like a beer can in its hand. Yeah, classic kid stuff.
Grumpy old men pranks.
Yeah, luckily that raccoon, that one was dead, but
Oh, jeez. Well,
and I don't think gloves were involved in that situation either.
yeah, as maybe they didn't think they were necessary.
Yeah, what's the worst that can happen?
Foolishness.
Rabies, apparently.
Right, Jeremy. Just foolishness.
Just tomfoolery.
Does Canby have a claim to fame in this type of distinction?
Yeah. What's your Florida story in Canby? They got one. It's the dumbest thing that's ever happened there.
You know, gosh, I'm sure there's been a lot of them. I'm racking my brain.
See, we should have been prepping for this well before the pod because you would have had to do some producing, I'm sure.
I would have. and then I probably would tell the story and then look back at it and be like, yeah, that's not even how it happened anyways.
Yeah, it didn't
So
take
long ago.
Nick or I more than a second to prep our dumb stories.
Yeah, well,
Unfortunately.
if I had a
Yeah.
raccoon story, that would be on deck. I
Yeah.
mean,
That's fair.
I've driven through Canby like hundreds of times now.
Yeah.
And maybe 33% of the time has been when school's got out. You got some dudes who look like they would pick up a coon. Yeah.
yeah.
It's like over under on it happening odds. I don't know. I'm gonna go.
Oh yeah.
No steeper than 3 to 1.
Yep.
Yeah, that's fair.
Yeah, we're not immune either, but I blame that for our proximity to South Dakota. You know, it's I think
South Dakota wasn't even involved in this conversation, Jeremy. Now you're dragging.
No, I was gonna actually
my
just
wife's
lump it
not gonna be
together.
happy.
I was just gonna lump the Dakotas together.
Pretty much one
Yeah.
Dakota, huh?
Yeah, yeah.
It's not
Yeah, there's a difference.
fair.
That's-
Right.
Yeah. One's on top. That's all I'm saying.
One's greater and one's lesser.
Yeah. That's not just geographical.
Yes, true.
No.
So what was it like at the Vikings game to see Christian Watson just drop that ball? Ecstatic,
No.
I assume, but also
I
for
was
me, it very
happy,
sad.
but I was like, oh man, poor guy, you know. But
Ugh.
it's like a microcosm of exactly how I felt when he got drafted by the Packers. I'm like, dang it, like anywhere but there, you know.
Yeah.
Yeah. High ceiling if you can catch the ball, but unfortunately Rodgers is very non-forgiving when it comes to that stuff.
Apparently, I don't know. He could have used all the help he could get that day.
Yeah, it was weird. I mean, there was definitely a couple of those sacks where he had receivers open that he just didn't trust, so he just didn't throw the ball. It's like, man, throw the ball, dude. It's not like
He was high though, probably now. I think we can
you think he
kind
did
of
some sort of
appreciate that.
ceremony before the game?
something.
Psychedelics, man.
Yeah,
Yeah,
I told
he's all about it. You seen that Barstool Sports interview with him?
uh-uh.
He's like, I can't think of the guy, the really funny guy who does these like fake interviews, but you got to check it out. I'll send it to you afterwards. He's like freaking high as a kite, eyes bloodshot, puffed
Rocket
up.
Man.
I mean, yeah.
Living his best life, huh? I mean, it's amazing. Jeremy and I were talking off pod. Like, his brain processing though must be pretty solid to like drop back, check a receiver, see they're open, and make the determination in your mind you don't like them and you're not going to throw them the ball.
No thanks. No.
Like most
You
people
think that's
can't
true though?
process
really
being an asshole in 0.3 seconds. Like, it's
Do
amazing.
you really think though if he's going to take a sack versus like throwing it back up to a guy who's open? I don't think.
After watching him play a few seasons, I do believe that's how he plays the game.
You know what he might do is say, "I would rather take a sack than the chance of throwing a pick." You know,
I could see that. Yeah.
You know, so if he's not trusting those guys, I don't know.
Because I do feel like when you watch the game, he was looking for a split second. You know, he was checking down his receivers. Unlike Brady, where like Tom Brady, if he doesn't like you, you watch him play. He's had some of those guys come over. He just doesn't even look your way. He just never.
He's going to get your ass off the team. He's like,
he's
get somebody over here who's going to catch it.
Yeah, he's just not even going to.
You don't mess with TB12.
No.
Yeah.
Dude's still winging and slinging, baby.
I got to give him props.
God,
looks good too.
Timeless.
I mean,
he's timeless.
Yeah, I mean, he looks better now than he did 10 years ago. Some of that is not just healthy living, I don't believe. He looks getting to be a little plastic looking in his older age. But
wow, that's judgy.
What do you think he's going like that?
He makes millions. I get to judge him.
You see that Chris Pine pick that's like caught the world on fire? You gotta check it out. He does. I don't know if it's just a bad picture, whatever it was. He's wearing way too much makeup and his hair is long, and like a lot of the memes say he looks like a retired female tennis player who's like calling the US Open.
Is this like a Chris Pine Tom Brady pick? Or just
no, I don't know where he was at. I don't know, but you're talking about maybe having work done or something like that, looking artificial. And this Chris Pine pick that's I've seen all over Instagram the last week. It's right there.
Still a good looking cat. I'm all right with it. Tom Brady though. I mean,
I'm just jealous. I don't have long locks, but so do you think
his hair has really gotten phenomenal?
How much do you think was Rodgers not trusting them or being anxious, or do you think he had some dizziness?
Oh, drug-induced dizziness? Concussion-induced dizziness? All of it?
Maybe a little both.
Cervicogenic dizziness? Maybe
a couple of those hits.
Probably not BPPV, but
throw your neck into a spasm.
Yeah,
Zadarius
smacked him.
BPPV.
Yeah, that was a hit. I didn't think he was going to get up. I thought he was done for.
Did you guys see the one where it was like not a late hit or anything, but Zadarius like hits him, doesn't sack him, and like Rodgers takes like a step and then falls down and then pops back up, gets in his face, and Zadarius gets in his face. Have you seen that one? Gotta check it out.
What's Rodgers gonna do there? Like,
and Zadarius, like once
he's a human superhero.
He is. Him and Daniil. That was amazing. In real life, they each go to their own side and they alternate. Whatever. I don't know what the call is, but it's it's so freaking intimidating. They each like hold up their arms like this, and they look. You're right. They look like freaking Thor.
Yeah. It's wild. I would not want to get hit by that dude. Like, Aaron Rodgers isn't a small guy either, but he's not that big.
Then for him to get in Z's face, and then Zadarius like gets right back there, and his eyes get like 3 times bigger, and I'm like, I wouldn't mess with that. and then Rodgers is kind of like, okay, sorry, buddy.
Yeah, my bad. Good play.
You could destroy me. So
you're totally gonna regret coming over here, Z.
Yeah, I just
who knows? We're all freaking flying high right now, but they'll find a way to win the division, and we'll miss the playoffs.
This is the year.
9 and 8.
This is the year.
I think we're looking good.
Yeah, I'm not a big Vikings guy, but they look good. They look good. Yeah. Every aspect of the game looked pretty decent. So
nobody wanted to cover Justin Jefferson.
Nope, that was pretty interesting as well. It's like, just run to an open spot in the zone. We'll throw you the ball. It's like nobody in disguise coverage.
I mean, right? You
put
just
somebody on him. Like, I don't know. That was a weird defensive scheme.
Kind of kept waiting for them to cover him.
Yeah.
And like, oh, maybe Thielen will get some, maybe Irv Smith will join the party, but no, we're gonna let Jefferson just torch us.
They said his average separation on all his catches was 4 yards. No
Seemed
one within
like
4 yards.
It seems like more. I agree.
Like, watching on TV, there was a couple catches where there was nobody even on the screen with him.
That 64-yarder, nobody was there.
Yeah. Wow.
They're basically lucky that that everybody was following like Osborne deep enough in the end zone, so they were there to keep him out from a touchdown and help him a field goal, but none of it mattered anyways.
As a guy with Adam Thielen on his fantasy team, I was hating it.
I had JJ.
Why would you throw it to anybody
else? I got
else?
JJ too. He dropped in my PPR league this week. I don't know how, but
PPRs. Can we all agree PPR is fake fantasy football?
No, I love it.
Yeah, that's way better.
PPR sucks. No, it's so
man. Give me scores. I want high scores.
No. Talked about this last time. If I'm not scoring 200, I'm not even trying anymore.
Agreed.
See, I'm a traditionalist.
I've got one league that's traditional, and I scored like 102 points, and the other, my tight end didn't score at all, and I scored 170. It's fun.
Yeah, it doesn't matter. No, you've taken the specialness out of it.
You gives you way more options. I like it.
I absolutely balled out. Had non PPR had 144.
Pretty solid.
Took second, right? I lost my game to the only guy who could beat me. He had 147.
That's a terrible feeling.
The next closest was like 130.
I thought you were gonna say I balled out and I scored 84 points.
Yeah, usually their actual football scores in Nick's league, it's like 21-8.
No, I had between JJ and Josh Allen, I had 66 right there.
That's my setup too. Yeah.
God, those two are so nice.
Yeah.
Yeah. Well, back to dizziness though, I suppose. Yeah. So we don't have a 3-hour megapod again.
Really hurt that transition. So we'll roll into a little talk on vestibular therapy. Just had actually a great weekend course on it. Shout out to Jeff Donatelli. Threw an absolutely banger of a course, if I'm gonna be honest. 2 days, covered a ton of stuff, and it was really good.
Jeff.
I was a little concerned when he sent out the pre-course material, and my coworker went with me, and she likes to print off everything, and it was 800 pages of pre-course material.
Oh my gosh!
I was like, "Ooh, this is going to be."
And you were worried about the printing expenses?
Yeah, I said I was worried about ink at that point. We're going to have to go through 2 cartridges.
Paper's not cheap.
$50 a piece. But it was great. He made it all very applicable. So that'd be a fun little topic to talk about. Really not get into the weeds too much on it. No, we have a lot of listeners that are PTs, a lot of listeners that aren't. So I'm going to try to address both. I figured I would go through quick red flaggy stuff, quick differential diagnosis, and then probably the 3 common ones we see as PTs. And just go through what a patient presentation looks like, what we as PTs are maybe looking for to help us guide that's what we're looking for, and talk a little bit about treatment, but probably nothing specific, just because of time. And you could probably do each one as its own show. If I'm going to be honest, some of these things, there's lots of different ways to treat it. So I'm also going to leave out concussion stuff because I think that's probably its own show too. That's just another different beast. So but yeah, in the interest of that, like I said, I know there's a lot of non-PTs that listen to this show, but this stuff's pretty applicable. So if I get too medical, I hope you guys yell at me, ask me to explain stuff as we go. I'll try not to, but and just as far as my background, why like I should be talking about it, I have done more than a weekend course on it. When I was a student, I was at the Banner Good Samaritan Balance Center. That's all we did was pretty much vestibular.
Oh, yeah.
Right. 9 out of our 10 patients were vestibular patients, and maybe one brain injury or stroke thrown in there every day. Then as I got out, that's kind of was an area I focused on. Did a lot of that rural, and still kind of I'm the guy that treats the more difficult vestibular cases in our clinic. Certified through MedBridge. Jeff Walters has actually a pretty good 3-4 course series on MedBridge on vestibular therapy. It's really good. You guys ever get a chance? That's the interesting thing about vestibular is there's not like a huge body that like certifies you in vestibular. There's like one group that does it, and it's, I would say, not really that common, that popular for people to go and get certified in it, even though we all kind of see it. So yeah, so that's a little bit of my background. So see a decent amount of it, I guess. I don't know. You guys treat much of it yourselves?
As much as I used to. Go ahead, Jared.
I was gonna say the same. Gosh, that was like, I swear that was like my first 4 patients. Like we used to see a fair amount of it in Marshall. We had ACMC right across the road, and we'd get a lot of like real hot acute cases that would, it'd be like, they'd pop up every so often where you'd have a eval show up and pretty acute BPPV, people coming in and, in a wheelchair, can't walk type stuff. I swear that was like my first 4 cases, like in the clinic, like my first 4 patients. I don't know if I've ever sweat so much, and that's saying a lot. And I'm like, so it was really a trial by fire, but that was so much fun too, though, because like you talk about home run treatments, as long as you're on point with your diagnosis and your treatment, like people can really see a tremendous amount of relief in a very short period of time. So pretty cool.
Yeah,
I think that's what drew me to it too, was seeing it as a student and being like, they can barely walk, or they're really miserable at one session and they're completely cured. I mean, how many things do we do in therapy that has that immediate effect?
Yeah, the turnaround time is so much different.
Yep.
Yeah. So you've dabbled a little bit too there, Dr. Doling, dipped your toes in?
Yeah. Actually, Jeremy's right on the money. Back when we were running a private practice in Marshall, man, we did a lot of vestibular. Man, a big shout out to Jeff. I remember a big crew of us went to maybe his first or second course he put on. Him and Glenda Feist would put this on together. And this was back in like 2012. As much as anything, it gave me just lots of tools to utilize for screening, examination, and then picking your treatment from there. I felt it made me a lot better treating chronic BPPV or not BPPV, chronic vestibular hypofunction, and kind of teasing that out, and then getting a heck of a lot better at analyzing and assessing which side to really roll people to with BPPV. I think having those tools really helped. And we did a lot. As I've transitioned out, really the only thing I do anymore is really ortho, tri-needling. We have other great therapists in Marshall that'll handle the vestibular stuff. And they got the goggles. They got their own room down here for that. It's been well invested in. So let some other better therapists than myself, more up to date on it, take care of them.
Hey, hate to say it, that dry needling, cervicogenic dizziness probably has a good place in that.
So I'll do that, and I'll do that plenty of times for people with like exactly cervicogenic dizziness, neck stiffness, stuff like that. So you kind of tease it out as you're going.
Yeah, very cool. So I'll kind of move on. Like I said, probably start with the big red flaggers for people. Just gonna kind of talk about general dizziness. If you wake up and you're dizzy, you feel off, you don't feel good. Everybody's probably had that at some point or another, whether it's from a cold or motion sickness, being on a boat, that kind of stuff. Probably the first big one is what we call coronary artery insufficiency, CAI. And really what that means is you're just getting reduced blood flow to your brain, whether it's from an obstruction or just maybe you had a malformation that's never been caught. You don't have enough room as those blood vessels get through your neck and your brain. So for us, patients present when they have this, it's usually pretty intense, pretty severe sudden onset of dizziness. And a lot of times I'll kind of describe, as some of the most intense head pain they've had. Some of the most severe just feel really terrible. They'll have that history, whether it's high blood pressure, high cholesterol, those same things that maybe a stroke person would present with as far as risk factors. And really, you're going to have lightheadedness related to neck movement with this a lot of times, versus spinning or that feeling like you're on a boat sensation. And it kind of comes and goes again. A stroke, if you're stroking out, it's pretty much progressive, getting worse. But when it's coronary artery insufficiency, a lot of times it's based on, again, positioning typically of the neck, but even the body in a dependent position where you maybe have the feet up, head down, you might get less blood flow, or the other way around. I mean, head up, feet down.
Is it carotid artery insufficiency?
You could, so carotid artery, vertebral basilar artery, there's a couple of them. So we just kind of call it generally coronary artery, I believe. Cervical artery disease, CAD, people call it too. So yeah, it can be carotid, vestibular-basilar. There's a few different that can affect you that way. Yeah, and really, so as therapists, our big things we're looking for with patients when they come in are, double vision, difficulty speaking, difficulty swallowing. We already talked about the dizziness, any, instances of fainting that's new onset with this stuff. What we call ataxia, so difficulty walking, or you walk, looks like you're drunk when you're walking, stumbling on your own feet. Numbness anywhere, especially facial numbness, head numbness, nausea, and what we call nystagmus, which just means your eyes are beating randomly. If you ever have a field test, sobriety test, when the cops shine the lights in your eyes and look for tracking, that's really what they're looking for, is to see if your eyes are beating, because anything that can affect either your ears or your brain can cause that beating. So those are kind of the big things we check out. We can do like an artery assessment in clinic where we put you in a vulnerable position and look for those things as well. I guess there's some argument whether you do that or not anymore. I've kind of seen it both ways. If somebody comes in with a lot of this stuff, I'm probably just going to send them on for further testing myself personally, versus checking vertebral artery test or cervical artery insufficiency test, where really that test is where we put your head back, rotated, side bent, really to bring you to end range. And honestly, the test is positive by stopping blood flow to your brain. Is really what we're doing. So the argument is it worth giving somebody a stroke or a mini stroke or transient ischemic attack, a TIA, just to prove something that you probably are pretty sure is already going on? So I guess I've moved away from that a little bit. I'll just do a cranial artery or a cranial nerve screen to see if there's anything funny going on, and that correlated with what they say, like, let's go get this checked out. I don't listen necessarily to carotid artery with the stethoscope or anything. I don't trust myself enough. I guess I'd rather send it on just to get checked out. Doppler's pretty easy to do. ED. So that's probably the first one. Second one's what we would call cervical instability. And that typically is going to be where there's like a fracture in some of the bones of your neck that's holding your head onto your neck. And it could be an odontoid fracture, which is a little bone that your neck kind of swivels on, or it can be a ligament tear that holds those bones kind of together, controls motion. Again, that patient's going to feel off. They're going to say they don't, feel right. A lot of times they will tell you it feels like their head's not sitting on their neck. They can get that off feeling, that dizziness feeling, because their perception of where they're at's really weird. Again, this is episodic too, based on positioning, what they're doing. If they're fatigued, maybe their muscles aren't holding them as much later in the day. They get this feeling, gets worse as they get more tired. Typically, this is from an injury, whether it's an old, a car accident, a fall, something like that. You can see it with certain diagnoses, maybe like Ehlers-Danlos, which is a connective tissue disorder that makes you really hypermobile.
Laxatives. Yep.
Yep. Or Down syndrome. You can see these people maybe a lot more at risk for like that Dens fracture, that little bone that your head spins on. Same with the ligaments, again, are more lax in that population. Again, rheumatoid arthritis too has a high incidence of fracture there. You might have a minor fall and could lead to a fracture that you wouldn't think of typically. If you look at your reasons to radiograph somebody after an injury, they might not fall. We call it the Canadian C-spine rules.
C-spine rules.
Yep. Those rheumatoid arthritis patients maybe don't fall under there, but because of the RA, still are at a high risk. So, and then the last one's tumor, right? You can have a tumor that can make you dizzy.
Yep.
For us in therapy, again, we're going to look for a lot of that cranial nerve stuff. So your vision, your hearing, your taste, how you're moving your muscles in your face, how your tongue moves, checking those kind of things out. And I did forget to say too, with cervical instability that we're looking for, we have a couple special tests where we can test how well the competency of the ligaments are in your neck. So like a sharp purser test. If we push on your skull, hold your neck, and your symptoms go away, that's not a good thing. The patient's like, you're a miracle worker. I'm like, no, I have terrible news for you. Alar ligament test where we can hold the head. If you hold the neck and you can still turn the head, that's usually not a good sign either. So plus we look for things, reflexes, some of those upper motor nerve lesion tests we can do, like a Hoffman's test, Babinski you could even do, even though that's typically lower. Pronator test, whatever they call that, inverted supinator test. Is that the right name for it? Yep. So there's lots of things you can check for quick to rule some of that stuff out as well. So those are probably the big 3 red flaggers that typically we'll check for, patients might have. Luckily, they're all pretty low instances. So then the next thing we look for is kind of differential diagnosis. There's some things that can cause dizziness that we're probably going to need medical assistance with if we can help at all in those cases. So some of those are things like vestibular migraines, or not vestibular migraines. Yeah, vestibular migraines. So migraines with dizziness. Really, you got to get kind of the migraines under control. Those people can have postural dizziness. They can have spontaneous dizziness. It really, as long as migraines come on 50% of the time or more with their dizziness, and they have that kind of 3 or 4 different kinds of vertigo with it, you're going to think of that's maybe more of a vestibular migraine. There's also autoimmune vestibular disorders. So you're going to want to check to make sure they're not, history of lupus, any of those autoimmune diseases. You're going to want to kind of rule those out first. There's not really a great diagnostic test necessarily to say that, but a lot of these autoimmune diseases, dizziness is one of the first signs. So just something to be aware of as you kind of take their history and talk about everything else that's going on. Meniere's disease is another one. That's a lot of swelling of the inner ear.
Yep.
These patients typically are going to have persistent dizziness, very severe vertigo. So they will feel like they're on a merry-go-round, but unlike some of the other stuff we'll talk about, this might last for hours to days. Typically bad enough where they have to be in bed, can't do anything, can't drive, can't walk really. A lot of times it's accompanied with ringing of the ears that goes along with the dizziness. So that's usually kind of a good telltale sign if their ears are ringing as they're dizzy. And again, that's going to require, there's some new medical interventions. When I was first starting out, really the best intervention for Meniere's disease was like a gentamicin, put an antibiotic in your ear that just wipes your ear out completely.
Yeah.
Kills your vestibular nerve. You have no balance in that ear, but at least you don't have the attacks anymore. But now they got some steroids and things that can help. Also diet, anything low sodium, that kind of stuff, keep the swelling down, all helps with Meniere's. But that's something typically we're not going to do a whole lot with as therapists until you can get it managed. Or if the treatment wipes out that vestibular system on that side, then we can kind of work on training the body after that. 2 more I got for you guys, and then we'll get to the good stuff. Persistent postural perceptual dizziness is another differential diagnosis, PPPD, 3PD. I don't know if you guys are familiar with that one. That's a little newer for me. And this is just dizziness that lasts like longer than 3 months. Doesn't fall into any other category. Interestingly enough, they actually used to call this, and I'm sure you guys are familiar with this term, like agoraphobia. Yeah, fear of going out.
Places,
yeah, they kind of consider them the same thing now. People didn't like going out because they didn't, it wasn't so much people. They weren't afraid of people. They were afraid of being in public and the feeling they would get, almost a panic attack type feel. So they actually kind of consider this like central sensitization for the vestibular system. When we talk about pain, so you always had acute vestibular episodes or recurrent vestibular issues that lead to this. So it might be somebody that's had acute neuronitis multiple times, or recurrent BPPV that causes increased anxiety, stress, reduced activity because of those things. It leads to this. And again, that's one treatment for this really comes down to antidepressants, things like that, a lot of psychiatric medicine first before you can really do anything else. So if it seems really recurrent, really severe, a lot of anxiety, those PDDM type stuff, if you have a lot of that social and psychological issues with it, you might want to look at this route. And the last one is mal-debarkment syndrome. Again, don't know if you guys are as familiar with that one, but these are the people that actually get motion sickness when they stop moving. Kind of interesting thing. It can be, again, episodic. They will go on a cruise and then develop this when they get off the ship, and it feels like they're still on the ship for a long time. They'll actually even sway in your room. They feel like they're rocking all the time, and they'll kind of rock in time with it to stop that. Or if they get in the car, it goes away. So a pretty interesting one. That one too, there's not a whole lot of research why or treatment wise for it, but again, it's that weird have to be moving for it to go away, which is atypical kind of the other stuff we see. So
yeah.
You guys got questions on those, comments, concerns? What do you think?
That was good. The 3PD
rundown for people. Yeah.
No, I like that. I was not as familiar with those last two.
Yeah. So I have a patient right now with that persistent postural perceptual dizziness. It's interesting. I saw her a few years ago, and at that time I didn't really know about it too. And it was like, she was like, yeah, I have agoraphobia. And now she's coming to me now for dizziness. Her agoraphobia, quote unquote, has gotten better because she's got meds and things on boards, but she still feels like she has, dizziness, residual dizziness. So we've been treating her for like cervicogenic type dizziness that we'll talk about here in a bit. So kind of interesting, because she was one that I probably wouldn't have been overtly successful. I saw her for her shoulder. We tried a little vestibular stuff, but with minimal results. And now I probably know why. So she's gotten that other stuff under control now, and we're seeing good improvement with that. So kind of cool.
That's cool. Really cool.
Yeah. And we just had another patient call us. Another therapist called us about that mal-debarkment syndrome too. So another kind of interesting one too, that is interesting aside. I had one patient with this too. If you ever have patients like feel like they have a whooshing in their ear, or their own chewing drives them insane, or it seems like they can hear their heartbeat. Hearing the heartbeat, first off, again, that coronary artery insufficiency, cervical artery disease, want to rule that out first if you feel like you can hear your blood pumping in your ear. But another thing that can cause that, and it's relatively rare, is I think it's called superior canal dehiscence. So the bones in your ear don't fully form. So all your internal noise is almost deafening because you don't have the bone to deaden it before it gets to nerves and things. And it's actually, that's a quick surgery. They just throw a mesh over that tiny little half of a dime sized inner ear, and you're good to go.
Cured.
Yeah. I had a patient that had that. It was weird. So
That's
but now,
interesting.
yeah. I had never heard of it. The patient described the symptoms, and I actually Googled it, and I was like, I'll be darned. It sounds like this thing. Yeah, it was a quick cure. So sorry, my
Google.
20-minute Google search. I get it isn't the same as your doctoral degree, but it worked in that case. So but yeah, move on to kind of the big three that we treat as therapists before I get myself in too much trouble. So as therapists, if we treat vestibular patients, about 80% of people that are going to come to us for true like vertigo, spinning type stuff, is going to be benign paroxysmal positional vertigo. There's some argument whether we should just call it benign positional vertigo, get rid of the paroxysmal. I don't know. It doesn't matter. One less B makes it easier to say. I'm fine with that. But again, your patient's going to present really with true vertigo. So it's going to feel like they're spinning, the room's spinning, and it's going to accompany movement, specifically head movement. But for sometimes patients will roll in bed. So their head's moving with their body. So they don't think of it as true head movement, but their head's moving. Pretty quick onset. They move their head, they start spinning within a couple seconds. Duration, we'll talk about two different kinds of positional vertigo, but typically durations 30 to 60 seconds for the most common type. You can get persistent vertigo based on some structure in the ear and a little bit of that anatomy. Not to go too into the weeds, but we have these little crystals that sit on a jelly mold in our ear. And when we move forward, back, up and down, the crystals weigh that jelly down. That jelly moves just like a jelly mold, moves those hairs inside that tell our body whether we're moving forward, backwards, up or down. We also have 3 fluid-filled canals in our body, in our ears on each side. And those, as we move, that fluid in them moves, and there's a little shower curtain at the end of each. And as that shower curtain pushes and pulls, that tells us angular velocity. So moving in the diagonals. And every once in a while, those little crystals, calcium carbonate crystals, will leave the jelly mold and end up in one of those semicircular fluid-filled canals. And that's what causes benign paroxysmal positional vertigo. As those crystals enter your ear, it causes that fluid to whoosh in different directions than it's supposed to. And that makes your brain confused, and that makes you dizzy. That's, it's just like if you're poisoned, right? You ingest something that your body shouldn't have. It makes you nauseous, makes you dizzy. It tells you something seriously wrong. Same thing with your ear. That's just your body telling you something seriously wrong. You're getting mixed messages from the different canals in each ear and then from ear to ear. So again, typically, if it's just in the canal, it's that quick 30 to 60 seconds or even less. I get patients that have 2 or 3 seconds of whooshing or vertigo, and then it relaxes as those crystals settle. You think of it like snow in a snow globe. Shake the globe up when you move. Once the snow settles, dizziness goes away. If those crystals end up on that shower curtain, well, that shower curtain just stays down. And the whole time that shower curtain's moving, it's telling you you're spinning, so you feel like you're spinning. If anybody's ever drank alcohol and laid down at night and got the spins, it's kind of the same thing. I know you two gentlemen have probably never experienced that.
Never.
But typically that shower curtain.
Tell me about your experience.
Yeah, I'll tell you about mine. I had it a few times. That shower curtain is the same density as the fluid. So the shower curtain only moves if the fluid moves. Well, when you drink, the density of the fluid in your ear changes because of the alcohol. It seeps in there.
Oh.
So when you lay down, the shower curtain actually drops down. The shower curtain becomes heavier than the fluid in there. So you lay down and you just spin and spin and spin.
Shower curtain in your ear.
Yep. Cupula, ampulla, whatever you want to call it. Cupula on the ampulla. So if a crystal ends up on that shower curtain, it's the same thing. You lay down and the crystal drags that curtain down with it. And
Jeremy, have you ever heard it referred to as a shower curtain before this talk?
I have not.
I like it. It's a good analogy. I was just making sure I'm not a total imbecile late to the party.
Yeah, I don't know.
No.
You can call it whatever you want. What do you guys use?
No, I'm fine with. I like that description. I've just never heard it described that way before.
Yeah, like a big fan blade. I don't know. Like one of those things you fan yourself with. You can look at it that way too.
Oh, like an Oriental Asian fan.
Yeah, right.
Watch
Whatever's
Easy,
appropriate to
Nick.
say.
Easy, Nick.
Whatever's appropriate to say anymore.
Oh man,
Good.
it's okay. Historically,
boy.
Nick's brother used to say that, so it's okay.
I don't think he even had that in the vocabulary.
So yeah, that's typically like I said, the patient's going to come in. It's sudden onset. This is typically a disease of aging. You see it in older patients more regularly. It can come from impact to the head. Those crystals can get dislodged as well from trauma, but more commonly, I would say in the clinic, 75% of the time, it's just as we get older, those crystals, like the bones in our body, start to wear away. They break off. You get little bits of debris here and there in those canals, and we just got to clear them out.
So Aaron Rodgers could have been suffering from PE.
Oh, he's got otoliths.
You get hard
That's
enough
the
blow to the
fancy
head.
medical term for him. That's why I wasn't throwing it to Christian Watson anymore. He's whole field was spinning. Yeah, so when our patients come in, we rule out all that red flag stuff. And then it's a relatively decently simple assessment for the therapist to do. There is a Dix-Hallpike maneuver that will assess 2 of those 3 canals in your ear. And that's as simple as we put your head in a certain position, lay you back, or lay on your side if you got a stiff neck. And we talked about that eye spinning earlier, the nystagmus. Your patient will have that. In the case of BPPV, it's going to be what we call torsional. So the nystagmus is actually rotational. And your eyes will always beat in kind of the plane of whatever canal we're testing. So when we bring you back in a Dix-Hallpike, you're either checking the posterior canal or the anterior canal. So the eye is going to beat differently based on which canal is involved. And you're actually testing opposite ears. So if you bring somebody back to check the left posterior, you're checking the right anterior at the same time. And their nystagmus is going to look different.
Makes sense. Yes.
So not to get too much into the weeds for those that aren't therapists, but you're going to get
we need a weed whacker for this today.
Yeah. So if it's posterior canal, it's going to be upbeating torsional towards the down ear. If it's anterior canal, it's going to be downbeating slightly torsional to your up ear. So that's what we look for as therapists to confirm it. There's a third canal, the horizontal canal. Typically, we check that in supine with a roll test where we bring your head up. Turn it one way, turn it the other. Again, we look for nystagmus with horizontal canal because the canal is in line with your ear. It's going to be straight across. Kind of the cool thing is it should go towards the ground either way. So if you have a left ear horizontal canal, I turn you to the left, it's going to beat towards the ground. I turn it to the right, it's going to beat towards the ground. And that typically is going to tell you, again, it's in the canal. So it can either be in the canal or on the shower curtain. If it beats away from the ground, then it's typically on the shower
curtain. Knew it.
And again, that's based on anatomy a little bit. If it's direction changing, that's a little more confusing. Could be in both ears. Could be canal in one, shower curtain cupula on the other. Not necessarily a sign of central symptoms. And when I say central, I mean coming from your brain. Multitude of things that can cause that, multiple sclerosis, strokes, things like that. Don't panic if you're a therapist and see that they're having a stroke. Because as we talk about vestibular hypofunction next, there are some things we look for to see if it's coming from the brain. This is not one of those.
All right.
So those are our big
Let's move
tests. There's also a bow and lean test that supposedly tells you which ear is involved. Because again, if you roll to the left, roll to the right, it beats the same. How do you know which side's affected? Well, the bow and lean is going to tell you if you bow forward and it beats towards one way, you lean backwards, it should beat to the opposite. And based on what you saw in the previous test, whether it's canal or cupula, that's going to tell you which ear is involved. So how do you treat it? Again, it's these semicircular, so it looks like a flattened bike tire kind of. All we do as therapists is we take the crystals from one end and dump them all the way around. So we're going to twist you around, and it's kind of a circle. It's simple, easy. You do it once, you do it right. Jeff always says that. It used to be you kind of would do it a couple times, but truthfully, if you take your time, get people in good positions, and be intentional with it, you should only have to do it once.
Very good.
So then you send them home. Should be cured at that point. Again, the crystals end up back on the jelly. The jelly's got a little glue on there. You let the crystal sit on the glue for a few hours, and you should be good. Some people can get recurrent, like we said, it's a thing of aging, but that bout of it should be over. Now you can have BPPV in both ears or multiple canals, and you may have to have a second or third treatment just to clear everything out. But
good to follow up. Make sure it's been reinforced.
Yep, kind of recommend a follow up in a couple days. I typically give people 2 to 3 days just to let everything settle down. If they've had really bad PPVV and they've ramped themselves up quite a bit, sometimes the vestibular system takes a day or two. Send them home. Typically, we try to keep people upright for about 2 hours. There's a little bit of research that you probably don't want to sleep on your affected side, but I'd rather have people sleep than not. So truthfully, if you can keep the affected ear up, gravity should assist you through the night, but again, not that big of a deal. You don't need a cervical collar anymore. You don't need to sleep with your bed elevated or in a recliner. That was kind of what we told people when I was first getting out, and really the research has shown nothing matters too much. But again, I would say give them a few hours, talk about what they're going to do. Don't go home and change out your trap on your sink. Don't go paint your ceilings. Don't put yourself.
I
in
feel
those
so
odd
good
positions.
now. Why wouldn't I do that?
You're going to want to give yourself a day, but don't nap for the first 2 hours. They're going to feel tired. Try to keep them upright, but that's kind of the quick and dirty on benign paroxysmal positional vertigo. I don't know. Is that kind of consistent with your guys' experience with it?
Yeah.
Nick, did you catch that?
Did I catch him say yeah? That was a deep
Did you catch my question? You seemed very confused.
No, I'm not confused. No, I think there's some definite new stuff there in terms of the process of testing it out and teasing it out. I think a little bit compared to what I was doing before. I was kind of going by a bevy of oculomotor tracking and kind of VOR assessment prior to help guide the direction in which I would choose to kind of like, instead of testing with the Hall Pike Dix, just go on a strong assumption after those tests on which side to really chase after, if that makes sense.
Yeah, and you do want to, I just did BPPV first because it's the most common. About 85% of patients with vertigo, dizziness symptoms are going to have it. When we go into vestibular hypofunction, you should probably rule those things out first. And I would say I would rule out everything else before I test the ear I think it's in. So if somebody comes to me and they said, yeah, I rolled to my left and I feel super dizzy, like I'm going to check out vestibular hypofunction. I'm going to check out the right posterior canal. I'm going to check out the horizontal canal bilaterally, and then I'm going to check the left ear. That way I know I've cleared everything else out. I check the left ear. I can treat the left ear. Otherwise, if you just go right to that, treat it.
You're going to do that with an acute BPVV, and you're just going to start rolling them.
Yeah, there could be other stuff you're missing. It can lead to frustration as you're going to keep going down that ear.
I don't know. I'd probably do something different, but to each his own. And you just came from the Jeff course. You guys are hot to trot. Go for it, man. But in my career, I think rolling people with trying to go on the horizontal testing, stuff like that, only stirred them up more. I don't know.
Yeah.
I don't know. I had pretty strong outcomes. I think it's like 96 percentile. God, sounds like I'm fucking turning a defensive prick right now, but
no, it's okay. Like I said, 85% of BPPV is going to be posterior canal.
Yeah.
I've seen one anterior canal in my career and a handful of horizontal. Nice thing about horizontal is because of the anatomy, it typically clears itself. I'll be honest. Research will show you that they didn't talk about this in Jeff's class, but if you just lie on your non-affected side, usually gravity will clear a horizontal canal. All right. If your affected ear is up, you're lying on your side. Should clear. Anyways, so that would just be my recommendation, is just to make sure you're not missing anything, because there's a lot of things that can masquerade as BPPV. So save yourself those troubles. Do it once, do it right, but make sure you don't have anything you need to have them keep.
But do you think there's anything wrong with, let's say somebody, you roll them, you get them stabilized, and then when they come back, you reassess them, they're doing pretty well, and then you provide a little bit of, like, what do you call it, habituation, strengthening for that vestibular system? Is there anything inherently wrong with that?
No, nothing inherently wrong with it. I wouldn't think so. I don't know if it's necessary either. You clear out the BPPV and you've cleared everything else out before that. Shouldn't need habituation training, but I don't think you're going to be wrong in that.
I'm thinking more for when you talk about recurrent. I think Jeremy would maybe attest to this too. We had a lot of people who would be maybe a frequent flyer every 6 months, 9 months, coming back in for it, and just trying to kind of close the loop a little bit better.
Yeah, I was gonna ask about that too, Casey, too, because you talked, like just a function of aging, but like, I mean, did you guys talk about it all, or is some of it just like a function of inactivity or lack of input into the vestibular system as we age too?
I guess that would come down to, then you should see some stuff with the rest of your testing that you're going to do. You should see some changes in some of the other vestibular systems if you're going to assume it's just general inactivity. Now, if they're have other stuff, right? If they're, there's more to balance than just your inner ear, right? Their vision, their ankles. I mean, for sure, if you get somebody that's 70, they're dizzy all the time and they don't feel stable walking, well, for sure work on that other stuff. That's,
But I was just saying, like, in terms of like very, very generally, not in any specific, like case or not, but just saying, is that a contribution to increased occurrence of BPPV, or does that not seem to be the case?
I would say the research wouldn't point you towards that. I mean, nothing should give you that torsional nystagmus other than otoliths in the canals or a tumor, So.
Yeah, I got you.
But I will say this, inactivity, not so much inactivity, but static positioning, especially laid back, can predispose you to it, right? We talk about these crystals. These crystals are probably falling off and typically ending up nowhere that matters, right?
Yeah.
You probably lose a crystal here and there and your body reabsorbs it. But say you're always lying on your side, watching TV in bed or something, and if that crystal falls off and you're in that position, the chances of it ending into one of your circular canals way higher. Right?
Yeah.
You're laid back into a recliner, it's going to fall. It's probably going to end up in a canal. You're upright moving and something comes off, it's just going to get dissolved back. Deal. It's in the utricle. Saccule should never really end up in a canal anatomy wise. You should never have to worry about the saccule. But I don't think that necessarily would be a factor, but I would say these people that have recurrent BPPV are probably deconditioned because they're afraid to move when they have it. I mean, 10% of elderly people have BPPV and don't even know it. They're probably just avoiding moving. Right. Yeah. So then you do have to address those vestibular systems, ankle strength, hip strength, knee strength. Probably have hypofunction in addition to BPPV at that point. But.
Yep. Cool.
Yeah. Sorry. And you talk about how things have changed, Nick. I would say big things have changed for me is definitely treatment of horizontal canal. We never did Gaffani's when I was younger. We always just did a barbecue roll. Now Gaffani has a similar rate of remission, and it's just an easier side-lying thing to do if you have patients that aren't as mobile. We also used to barbecue roll people 360. That now they say 270 is actually much more effective and easier for your patient. So you don't need to roll people all the way over. Get their arms caught under them, get up on their elbows so their head's not, leaned, don't have to worry about that stuff. The bow and lean was something we never used to do. And I don't know if I use it that much anyways. Hard to see, especially that bow part, because you as a therapist have to get way down to see their eyes. That's definitely one that works better with goggles, I think.
Sure.
And typically when you do a roll test, one of the ears is more intense than the other anyways. So if you roll somebody to the left and their vertigo symptoms are way higher, that's the ear you're going to treat anyways. But it's those cases where they're like, it's like a 5 out of 10 on both sides as far as dizziness goes. Okay, maybe the bow and lean can help a little bit, but and 2, when we did a canalith repositioning, epley, whatever you want to call it, I was always taught if it was anterior canal, you treat it just like you would a posterior canal, because again, they're kind of opposite each other. But now the new research is saying if you do an anterior, you don't go into the side lying position, you just sit straight up, because then you don't risk repositioning it into something else or having it slide back, just based on how the anterior is lined up. So maybe some tidbits for therapists that have been doing this a while and haven't been updated. So
yeah, I like that.
The next one that's pretty common, I think we still got a little bit of time, vestibular hypofunction, peripheral hypofunction, unilateral vestibular dysfunction, whatever you want to call it. This can happen after trauma. It can also kind of come on with cold sores, things like that can kind of predispose people to this. Sinus issues can predispose people to this. And really all this is you have 2 nerves in your ear. One's a balance, the vestibular nerve that we talked about ad nauseum already, and then you have your hearing too, your acoustic nerve. So when the vestibular part of it gets hammered out, that's when we have this hypofunction. And typically what we look for then is some different eye movement stuff. There's a reflex between your eyes and your ears, vestibular ocular reflex. We'll call it a VOR for short. And really all that does is, you can fixate on an object and turn your head quick, and you can maintain focus on the object, because you can actually turn your head faster than you can turn your eyes. So you have to have a reflex that keeps you focused on things. Likewise, as you're walking, right? We walk, our head moves typically, but it doesn't feel like the world's moving with us, right? So our eyes kind of move to adjust for that head movement as we're walking. So that's that vestibular ocular reflex. Sometimes these patients will come in and say it feels like they're watching a shaky cam movie or something, like a home movie. They feel like they're on a boat. They feel like they're dizzy, drunk. Those kind of reports we'll get. You can get vertigo symptoms with this, but typically if they get spinning, it's very early on. If they have a really strong acute neuronitis, we'll call it, so the vestibular nerve gets attacked pretty hard acutely, they can spin to the point of vomiting with this. Good news is that acute neuronitis phase really goes away pretty quickly, 24 to 48 hours. They'll end up in the ER and they'll give them meclizine and then they'll feel better in a day or two, but they'll still have those residual symptoms. So as a therapist, again, we're looking at how their eyes are moving. We check for what we call spontaneous nystagmus, so that eye beating. If they're just looking straight ahead and their eye beats, it can be a sign of hypofunction. It can also be, again, a central sign, so it's coming from the brain. How we suss that out a little bit then is we have the patient look. If a patient looks to the left and it's always beating to the left, they look to the middle, it's beating to the left, they look to the right, it's beating to the left. That's usually more of a sign of a right-sided hypofunction. So your eyes are always going to beat towards the more active ear if it's not central. Again, in acute neuronitis, you're going to see that beating in all 3 positions, left, middle, right. As it improves, it's going to go away, and you may only see the nystagmus when they're looking one direction. And if it's a hypofunction, it should always beat towards kind of the side they're looking to, or the side that's active. So you should see diminishing returns as time goes on with that, to the point where within 6 weeks, that nystagmus might even disappear with that. So if you get somebody that's been feeling like this for 6 months, you might not see that position evoked or gaze evoked nystagmus. But that's when we go into checking that vestibular ocular reflex. So we'll take a patient, have them focus on an object, whether it's their nose or a tongue depressor, turn their head left and right. Again, they should be able to maintain their eyes on that. And you as a therapist can see that. If their eyes move with their head and then come back to the object, that's going to tell us there's something going on there with that reflex. We can also do what we call like a head thrust test, where they'll look at our nose and we'll shake their head a little bit and then do a quick turn. Again, they should maintain focus on your nose with their eyes. If you turn their head to the left and their eyes go to the left and then swing back, that's going to tell you the left ear is involved. If you do it to the right, it'll tell you the right. There's a little research that says you can do it in the diagonals to check for BPPV. I don't know. I guess I've never done that. Is that part of what you've done, Nick, when you say you kind of check out these ocular stuff to let you know what's going on?
Yeah, the head thrust, but not so much the diagonal pattern.
Yeah.
Yeah, I've never done diagonal either.
So
pretty darn accurate. Check it for the latency too. Did you guys talk about latency with that?
A little bit. That's sometimes maybe harder to, when you say latency, you're talking about how long it takes to like swing back.
Correct. Yep.
Yeah.
And they're looking for any nystagmus that gets evoked with it too.
Mm-hmm. And then we'll do like a head shake test, but a person really should probably have goggles or some way to stop you from focusing. And that's where you have a patient, you shake their head 20 times and then they look straight ahead. Again, their eye should be towards their active ear, so their other ear would be the one that would be effective. Goggles are really kind of the gold standard to do that test. Last test you can do is a visual acuity, dynamic visual acuity test. So you have them look at the eye chart, see how good their vision is, and then you shake the heck out of their head and see if their vision's the same. 2 lines, shouldn't be more than 2-line difference with that. If it is, it's probably hypofunction. And then when we're doing those tests, we also check, again, those central brain signs. So you're going to have patients pick 2 targets, 2 fingertips, typically look back and forth between them. If they miss your fingertips and have to swing back, really large swing or multiple little eye tracking movements to find your fingertips, that's a sign of something central, whether it's stroke, MS, something like that, something more serious, you see that. We already talked about the spontaneous nystagmus. Same thing when they're following your finger. If that nystagmus changes direction, so it's beating to the left, and then you go to the right and it beats to the right, that's probably a sign of something more central. Or vertical nystagmus is typically always a sign of something central if you're not doing epilepsy with that downbeating. So you should not see vertical nystagmus very often. And again, just your standard ocular motor testing too, you give a patient an H, they should be able to follow your finger. If their eyes are swinging back and forth, they can't track your finger, that's typically a central sign as well. So those are kind of the things we suss out. Again, Nick and I do it a little differently. I like to just clear those out quick before I do my epilepsies, because if you have hypofunction or a central symptom, they can kind of mask when you do your BPPV testing. So I like to clear them out. They're pretty fast. You can do them in 5-10 minutes, snag their blood pressure, run through those quick, and then head out to the gym.
No, that like I do them all before I roll people. Sorry if I was confusing there, but I still do all that testing before I even roll anybody.
Okay. Then I think we're splitting hairs.
Yeah, my point's not to. Never mind.
Yeah, you're saying when you're checking for BPPV, you just go right to what you think is the cause.
Yeah. Well, I know I go through all that. I go through that whole test cluster. I throw in ocular tracking. I throw in VOR. I throw in head thrust, just to help guide that. And even if it is BPPV, it seems to lead you in the side in which you want to initiate that roll. And then I don't even, because basically your Hall Pike Dix, was the first step, step 1 of your positioning anyway. So might as well just go down there and then finish the roll, and make people better for it. So, and I typically, the only thing I do a little bit different, I don't know why, other than just experience and success with it, is I'll do a second one, maybe 5 to 10 minutes later to that same side, whether it's just to help further, I don't know, reinforcement we just did. And seems to be a good sign when people go through that and they're nowhere near as provocative as they were during the initial repositioning.
Yeah, I would say historically I've done it 2 times too, but I don't know. Jeff makes a good point. Do it once. They may have symptoms the second time you do it anyways, even if they don't have crystals, just based on ramping up the system. But no, I get it. Yeah. I think that in theory, if the anatomy's right, you do it right. You should only have to do it once, but
in theory, you do it
Yeah.
once, then you shouldn't have to do it again. So they should be stable, and it shouldn't matter if I do it a second time, right?
we talk about landing on the glue, let the glue stick, right? So
We just got done talking about how we don't collar people.
The glue didn't
We
cure.
don't make them stay up.
yeah, but you're also with your second testing putting them right back into the position of most provocation, right? The crystals would maybe potentially fall right back through the shower curtain.
I don't know. I've never had
yeah.
that happen once, so I don't know.
Okay. We'll agree to disagree on that. So
It's fine. That's fine. We don't have to agree on everything.
Yeah, well,
That'd
totally
be a weird
agree.
world.
So those are kind of the 2 main ones. Third one, cervicogenic dizziness. I don't know how you pronounce it. I don't know what the correct term is. And that's really dizziness.
Potato.
Yeah, stemming from the structures at the base of your skull. There's a lot of really sensitive muscles. We talked about that last time. Plus, you have a lot of nerves. The 3 cervical nerves that come out of your neck, wrap around, reach your trigeminal nerve, innervates behind your eye into your face. So people have these dizziness feelings with head movement, neck movement. So typically, a cervicogenic dizziness is going to be feelings of dizziness in combination with neck pain. So movements that hurt their neck cause them to feel dizzy. Again, it's going to be kind of come and go. Right. Days they feel neck feels good, they feel good. Days their neck's really sore, they're more dizzy. It can last minutes to hours. Really, with cervicogenic dizziness, we shouldn't see any nystagmus. There's been people that have said they can palpate the neck and reproduce nystagmus. I don't know if there's a lot of research that would back that up, but anecdotally in the clinic, people have said they've seen that. Put the neck in positions and see nystagmus, palpate C1, C2, well, C2, C3, and see those symptoms with it. But I've never seen that. And again, you might have some neurological signs, symptoms based on age and some of those degenerative changes, but that's not a huge diagnostic for us. Again, these are going to be the patients where you're going to clear out the neck, range of motion, quadrant testing. You're going to see that stuff. You might even do some, joint mobilization type stuff, see if that reproduces some of their dizziness. Another test therapists might do is just like cervical, like proprioception, kinesthetic awareness. So I use a laser pointer in the clinic. You have a target on the wall. You put the laser on the target, close their eyes, turn their head, line back up to neutral. There should be, I think it's like 7 centimeters. We have a target if it's 2 lines off, but I think it's like 7 centimeters difference at 90 centimeters away. If they are, that might be an indicator that something's going on there. Their neck and their eyes and their ears are not agreeing on where the head should be. Makes you feel dizzy. Another test you can do is have people in a stool, spin themselves on the stool 90 degrees versus fixating their head and having them spin the stool. If you fixate the head, spin the stool, and it reproduces their dizziness, it's probably coming from their neck because their head's not moving. It's their neck. So some tests you can do to help kind of rule that in and out. There's some other interesting tests, like a bucket test. Have you guys seen that, where there's like a line inside of a bucket and you have a plumb bob on the outside and you let them tell you when the line is straight up and down. And there's a certain amount of degrees that they're off would tell you that, again, they're having some neck issues. So they might say the line's straight and then the bucket's going to tell you they're 10 degrees off center. So That was kind of interesting test. I've never seen that before. I always just use a laser pointer or the stool test myself. But and again, treatment with these people, I guess I should have said that with vestibular hypofunction, we treatment's just going to be vestibular ocular reflex testing, moving your head in different planes while maintaining focus seems to be the best way. You can do some habituation training like Nick talked about, do some of those motions that provoke it and do it often, let the brain reset. You can teach people some techniques to kind of fixate on objects when they transfer, things like that, if they're really not getting it, just to help them. But typically head movement, focusing on objects is the best way you can do it. If it's acute, you might teach them to look first, then turn. That's a good technique for vestibular hypofunction. And then cervicogenic dizziness, treatment's really a lot of our therapy stuff. We do manual therapy to the neck, strengthening to the neck, deep neck flexor strengthening, dry needling, again, position awareness, kinesthetic, proprioceptive type stuff for the head, isometrics, all those classic therapy stuff that we probably do at any other joint. So, whew. Well, I am.
You did it.
Parched. I did it. I made it through.
You did it.
That's a lot of stuff. Like I said, we could go into the weeds on any of those.
I'm dizzy.
Oh, ooh, sorry, Jeremy. It's my bad.
Not literally. No, it's good.
Yeah. Fixate on an object, turn your head left and right, up and down, and then move the object as you're turning your head. That's your next step. So research will show you really need to do that for 15 minutes to get your best results. So,
all right.
So if you guys are dosing 60 seconds, a minute with those, really the research says 15 minutes neuroplasticity, huge difference in 1 week gains. So a little tidbit for you guys.
One session or
15 minutes at a
cumulative?
I believe it's 15 minutes at a shot, but
wow.
I would say you could probably break that up a little bit. Yeah. Again, research versus pragmatics, realistic for patients, but it's like anything. If we're shooting for neuroplasticity, they should be doing it a lot.
Yeah.
I'm sure you guys did that with habituation training, whether it was in the corner, head turns, head tilts, eyes open, eyes closed. Do it a ton. More the merrier. You know, push into symptoms, let the symptoms settle. Go back
exactly.
Ahead. You know, same with vision tracking stuff, EOR stuff. You got to get symptoms, you got to let the symptoms settle, and then go back right into it. So like anything else, you got to nudge into those symptoms. I guess I didn't specifically say that. BPPV, you don't really have to. You're going to get symptoms, but the other ones, get your symptoms, let them calm, go back to it. It's retraining. So
very good.
Yeah, it's quick and dirty. Hopefully we educated patients and PTs. So
yeah, I think a good takeaway for the common person too is like just that there is treatment for it. Actually, no joke, this was up in Fargo when I was a student. I was up there on a clinical at Sanford, and I was just at like GNC picking up some pre-workout, and this lady is trying to buy supplements in front of me for dizziness, and I was like, like, you can go to PT for that. She's like, what? And it's just like for as widespread of a issue, or I guess as common of a thing that it is, again, a lot of it depends on if the PCP is thinking of that as a treatment as well. But here's some Equazine, go home. But I just say there is help for it. Go work on it. It's my takeaway. Yeah,
there's a ton of dizziness causes that physical therapy and you as a person can work on. So speaking of supplements, I'm not a nutritionist by any means, but there's been really good research on vitamin D supplements and dizziness as a whole. So
interesting.
If you are one of those recurrent BPPV, recurrent hypofunction people, there's really good research on vitamin D supplementation. If you're a vestibular migraine person, enzyme CoQ10, aerobic activity have really good research on helping you out with that stuff. So even for those things, there are options too. Go see your PT, go see your primary, whatever your route is that you have to go, but you don't have to be dizzy. And like I said, 10% of people like over the age of 70, I think it was maybe 65, have BPPV, never been diagnosed. They told them you're getting older, you're dizzy. Dizziness is just part of being older. There's no cure for it. So if you know somebody that has some of these symptoms, encourage them to go in. Nick will treat you twice in 2 minutes and you'll be out of there. So
I'll be walking out. You'll be doing freaking back handsprings.
The cha-cha.
So
and you won't shake yourself back up again.
And within 2 hours, you're allowed to go back to playing your favorite video games.
All
which
right.
leads us to our top five.
All right.
I never get to do the transitions. I felt good about that one.
That was good.
I liked it.
Yeah. So we're going to move into our top 5 video games from our youth. So games we played from the age of 0 to 18. I don't know if any of us were video gaming at that, but 18 and under, which is interesting as for me personally going through this list, there's a lot of video games for systems I actually got into older. There becomes a lot more access to video games as I've gotten older, whether it's money, internet, semi-legal means. I played a lot more video games in college, and even now as an adult, when I see games from my youth, I go find them and play them. So if you were to ask me what my top 10 Nintendo, SNES arcade games, those lists are all wildly different than this list, because as a youth 18 and under, not a ton of money, didn't play a ton of games, so it's changed my list a little bit. This list encompasses all systems. I don't know if you guys did PC games at all. I did not. Okay. So PC, arcade, console, it's all on here.
Oregon Trail.
So,
I wasn't even thinking Oregon Trail.
Oh, and this, it's interesting. This is such an encompassing list. This is one of those lists where a year from now, if we do it, might be wildly different when you think about it, because there's a lot of games. There is a lot of games. I said we didn't necessarily have access to a ton, but played a lot. And I got to be honest, I didn't spend a lot of time on PC games, so there was a few bangers on there we played.
You just opened my mind up.
You think your childhood list would change a lot in a year?
It might, just based on the fact that I've spent a week thinking about this list. There's probably games I didn't even think about. I
mean, that always happens. Yeah.
So there's a lot of games. Like I said, if you were asking me my top 5 SNES, NES, right now I know pretty solid what those lists are, and I don't know if they're going to change a lot. But this list was so big that I'm sure there's stuff I missed. And even now thinking about it, I'm like, man, if I'm true to myself, like what games did I really play a ton of?
I think mine was pretty honest. My top 2 or 3. 2 to 3 are pretty darn spot on.
All right, gentlemen. You want me to kick it off?
Do it.
Yeah, go for it.
You guys feel good about that? Nick, you seem confident in your list, so I'll let you go last. My numero uno, or my numero 5,
Cinco.
Is from 1992 arcade game. This game was a banger. It was a game I would actually just could not wait to get back to. Aladdin's Castle and Minot to play. It was the biggest arcade game there was. It was something I was totally into, and it was X-Men the arcade game. I was a huge X-Men kid, 91, 92. This thing was monster. It was 6 players, 2 screens. There was nothing in the arcade really like it. It was a beat 'em up, which was kind of my preferred thing. Me and my brother could play it together. Again, having an older brother kicking the hell out of me in Street Fighter and Mortal Kombat kind of sucked after a while, so it was nice to play something together. And like I said, man, we would play the sucker. I'd spend $5, which was a lot of money back then playing this thing. That's what I put all my money into. And I couldn't wait to go back and play it, man. I begged my mom to go back to Minot to play this thing. So that's my number 5.
Back up to Aladdin's Castle, baby.
You got it, man. My brother had a membership to Aladdin's Castle where once a month after the mall closed, they would open Aladdin's Castle up and you could play all the games for free as much as you wanted.
It's nice.
That thing was
nice.
Cool.
That's nice.
Yeah. I don't remember what it cost us, but that was baller. That was an event for us.
That's cool. That is cool. Well, I can go next, Jeremy, if you'd like.
Go for it, man. I can go anywhere.
As could I, but I guess I'll go.
First was exclusively where I wanted to go.
Mine is an arcade game as well. Found its home in the Carrington Youth Center, and nice little kind of unique game. Because like Casey, it's not really like a beat 'em up, more of a shoot 'em up and beat 'em up. It's Narc. I think I looked it up. I think it was made in like 1990 maybe, or 88, and then it kind of had some second life in 90 on some of the platforms. But
yeah, when it was on Teenage Mutant Ninja Turtles, the movie.
Yeah, which also was an arcade game that was on my short list. It was the Ninja Turtles, but Narc made mine because it was so cool. Very different from anything else that was out there. A little bit more edgy, more mature, kind of fit the late 80s, early 90s hard R action vibe. Just a couple good badass cops trying to get the drugs off the streets. Pretty good stuff.
Yeah. So just like movies in your youth, you only played R-rated video games as well.
The first two.
Yes, exclusively. Yeah. It didn't have blood. Nick's brother wouldn't let him play it.
Oh, it was pretty sweet. So that's my number 5.
Yeah, I'm familiar with the game. Definitely one I've played since I was 18. Like I said, you guys know or don't know, I have a full-size arcade in my house, so I play a lot of those old games now. Enjoy them. That's a good one.
That's what's cool.
Up. That's sweet. You got that. That's pretty awesome.
If you ever stop by, we'll play any game you want, man.
Do it right before tailgating.
Cool. Yeah.
Huh?
Yeah.
No, you guys opened up my eye. Like, I didn't even think arcade. All of mine are console games. I didn't even think computer. I didn't think arcade. So gosh, I could think like Area 51 at PK Egan's. I think it's still in there. That used to be the jam. Growing up too, you had
Area
to go
51.
Pizza Hut and Devil's Lake, man. You had to play
Cruising USA, man.
What was the name of the gun? Was there a game called something Wolf where you had a Uzi?
Wolfenstein?
No.
Operation Wolf.
Operation Wolf, where you had like the arcade game with the Uzi.
Yeah. And then they had it on Nintendo too with the light gun. Sucked on Nintendo, but it was cool in the arcade. Yeah, Terminator 2 with the Uzi too.
The arcades rattled, dude. They were like.
It's funny. They just rolled through it. I think it went from Operation Wolf, then to Terminator 2, and then to that Aerosmith game. It was all the same machine with the same gun. They just changed the card inside.
Aerosmith. All right, Jeremy.
Sorry, anyways,
Sorry.
back to my number 5. I kept it console. This came out in 2001. Tony Hawk's Pro Skater 3. So I would have been in like late high school, sophomore in high school. GameCube. That was the first one I had played. But man, just skating around the world, like that was sweet. They had a lot of good like little side missions that you had to do along with the story. Probably a sport that I wish I like secretly could have done growing up. I always thought it'd be sweet to
not a 7-foot man's game, Jeremy.
Hit a kick flip, it wasn't for me, but someone you gotta be able to dream, right? So
dream big.
Dream.
So that's mine. Tony Hawk's Pro Skater 3.
Could you go online with that one?
No. Nope, I did not have online capability until I got an Xbox 360.
Because my buddy had a Tony Hawk for the PS2 that back when they had the modem.
That
was like the first time my mind was really blown with like how much better people were at video games.
Yeah,
because you'd get on these courses with dudes, and they would literally be doing a trick for like 15 minutes, and we would just sit and not move on our skateboard and watch these guys like go around. It was unbelievable.
You were the original like YouTube fans, before YouTube.
I was just watching these Twitch guys.
Kids. We nag on kids.
Right?
Yeah, right.
Twitch
We nag on kids. You're like, what are you doing? I'm watching someone play Fortnite. You're doing what? You're not even playing video games?
They're freaking incredible. Now shut up. Oh, I like my
You
Pop-Tarts.
started it.
Yeah. I'm not gonna lie, I get sucked in with my son sometimes. He was watching people play Pokemon, and I'm like, oh, that dude's pretty solid. I get it. I get it.
Went through a college stage where I would just play like Grand Theft Auto Vice City, and Michelle and my roommates would watch me for hours. Just like, yeah, that was the closest we got to it.
Oh, I watched my brother.
You're usually hungover on a Sunday. Like
I watched my brother play a lot of video games, so I get it.
So what's your number 4 now, big boy?
My number 4 from 2001 PS2 game. Probably my least known popular game on here, but I think it sold a couple million, so it's not like unknown. It's a game called Jack and Daxter from 2001, open world game. Here's the thing, like I was not a big open world guy. I never had Zelda for either Nintendo, Super Nintendo, didn't have anything like that. Super Metroid for the Super Nintendo, I didn't play until after I was 18. The Castlevania Symphony of the Night, like none of those awesome open world games I've really played. This was kind of the first game for me, other than like Spyro the Dragon for the PS1, where you could kind of go back and forth and you had to collect stuff. And it was just cool to try to get 100% on every level and find every little thing. I just love this game. The graphics were cool. It was really tight mechanics. Spawned a bunch of sequels that weren't as good because then they really got open world, almost Grand Theft Auto-esque after that. After Grand Theft Auto hit it big. I didn't enjoy them as much. But this first one was a real tight game, good story. I played the heck out of it. I had to get 100% on everything. Probably the first game I ever really like got 100% plus bonuses on. So yeah, plus Jack and Daxter, PS2, 2001.
Jack and Daxter.
Yeah,
cool. All right, I have not heard of that, but
I have not either.
It's an average game at best, I would imagine, but I loved it. Again, this list, you didn't have a lot of games, man. You love the games you had.
That's very true. My number 4 is a game that I played quite a bit at my older brother when he graduated. Kind of bounced around the area and was renting out a house on our farm and working. And he had a Nintendo 64, and I would go over there, especially like during wrestling season. You got to kind of stay on the straight and narrow. You're not ripping it up late night. So I go over there, hang out in his basement, play a lot of Doom 64. My other rated R video game. So there they are back to back.
Lots of Duke Nukem, not quite that hard.
Yeah, lots of long missions, stuff like that. But it was just a fun game. Sucked me right in with that first person shooter. I hadn't really played a ton of that to that point. I had some friends. GoldenEye was kind of on my short list. I had some buddies who were super huge into GoldenEye, but I just didn't play enough of it, I think, to
makes you hate it when they're all so much better than you.
Yeah, plus I'd make it like 5 minutes and they'd smoke me right away.
Slappers only.
They're playing like nonstop. But I played so much Doom 64, and I can remember just chilling on his couch, like, 3-4 hours on a Friday night because, hey, I got nothing else I got to do. I got to get up tomorrow morning and get on a bus and go wrestle. So I'm going to, watch my weight, sit here and play video games. So that was a good memory for me. Lots and lots of hours that. So Doom 64 was my number 4.
Big fucking gun. I'll always remember that. Sorry.
The BFG.
Sorry for cursing.
Yeah. And I think it's kind of as we transition in October, we have underrated. I don't even know if we call it
Don't even say
movie.
it. That movie.
But Doom is so much better. It's so much better than people think it is.
It's good for the last 15 minutes. When he goes first person, that's pretty badass. I like that part of that movie. But
yeah, and I'm kind of a Carl Urban mark, but yeah.
Dude, Doom 64, was that Doom 1 and 2 combined on the 64? Do you remember?
I'm wrong to ask. I'm not sure.
Yeah.
I know it went on forever. It felt like I was playing it forever.
Yeah, we played our high school. We had the little computer lab, and like there was like one kid, we called him a hacker, but he just like knew like how to put a disk in a computer. And like he put like Doom on every computer, and then he put Quake on every computer. So those games definitely have a spot in my heart because we had the LAN, so we would sit and Descent. We'd play that in computer lab. We'd flip between, because like computer in 8th grade, it was like type these words 100 times. We would just copy, cut, and paste, and we'd be done in like 2 minutes, and then we'd just play Doom in the background or Quake. Yeah, those are great games.
Rebels.
Again, keep in mind, this is like an old, like he's renting out this whole farmhouse, like right on our lot. So the base was pretty dark. I mean, it was like easy to get yourself creeped out. All of a sudden, you open the door and there's a monster on the other, and you're like, woo!
Yeah, if you guys ever get a chance, there's a book about the two guys that started id Software or ID I think it's id, based on your id and ego and stuff.
Yep.
That's a great book. Those dudes were just gunslinging, and how they came up with how to get beyond the technology limitations of computers that time to create that first Doom game. I mean, it really was revolutionary. It's pretty cool. That's a cool story. The one dude's still doing Cormac, I think is his last name. I mean, he's still computer programming for some high-end stuff. He's in the virtual reality stuff now, but these guys, man, they were rock stars. It's crazy. They had like a Ferrari in the office and stuff like that. Just, they were printing money for a while.
What a life, baby.
Yeah, because that Quake engine, still to this day, you hear about all these games using like the Quake engine and stuff. I mean, stuff he came up with is unbelievable. So cool read. I don't remember the name of the book, but it's a good book. Look it up.
The fact they made it.
Do your own research.
Yeah, I'm gonna produce it. I'll actually produce it while you guys are doing your list.
What's your number 4, my man?
My number 4 is also N64. I gotta apologize to Casey too, because I have heard of Jack and Daxter. That was just a PS. That was a PS specific game. I produced
Correct.
it.
Yep.
Yeah. No, that was actually a pretty big game. I just didn't realize the name. Like that, they had like 5 different installments of that. I think.
Yeah, I think it got shadowed by Ratchet and Clank, kind of.
Yeah.
This is maybe just a bigger series.
But anyways, my number 4 is The Legend of Zelda Ocarina of Time. So this came out in 1998. That's my first Zelda sighting on this list. But spoiler alert. No, that was actually the first Zelda game I ever had played. Totally love I'm not like all about like the like fantasy piece of it, like the fairies and whatever, but like, man, the puzzles, the dungeons, like the kind of thought you had to put into that game, I don't know, it topped. I mean, it was more like you're solving a mystery than playing a video game, right? Like there's certain components of that, beating bosses and stuff, but no, that got me hooked. So, and then actually for a long time after that, the only thing that I would buy was Nintendo consoles, because Zelda was only on Nintendo. So
that's true.
Big deal.
Yep. That's my number 4. Ocarina of Time.
Say that again. Slow down.
Ocarina
in Time.
Yeah. It's like this little flute that you can use to control time. So
you've never played this game, Nick, or are you just questioning his pronunciation of Ocarina?
No, I've never played it.
Hey, Ocarina.
I mean, I stopped at Link. I played Zelda and Link on the NES.
So again,
was there Winds of Time? Was there like one called Winds of Time or something like that?
What's the newest one? Wind Waker. What's the newest one?
I don't know.
Something like that.
It's your number 3.
I played this game later, and it was a good banger. My number 3 from the year 2000. PS2. This game completely changed what I thought a sports game could be. It seemed like such leaps and bounds from the PlayStation 1, and it was Madden 2001. Just unbelievable. The leap from, I used to be a game day guy on the PlayStation 1. You know, just this blocky stuff, to 2001, like at the time, felt like you were watching live TV. It was crazy.
But it's blocky.
Yeah, it looks horrible.
Yeah, it's crazy. Right?
But I couldn't believe,
you just
can you believe these graphics?
I got more to come here.
The training drills, the million plays, like the playbook was crazy huge. We played this thing every day after school for probably a whole year. I mean, it was
that's cool.
The start of the Madden curse. I think 2001 was the first year that like didn't have Madden on the cover and featured an athlete on the cover.
Who was that? Like
Eddie
George or something?
Yep,
it
Eddie
George?
George.
Yeah.
Yep. So yeah, a great game. I can't say enough about it. And then obviously I think I feel like that really spawned Madden to be the dominant football game from that point on. I mean, there was a period where like the 2K2 and stuff was semi-competitive, but it was so much better than anything
did like
else.
2K2 even get did they get licensing for all the teams though?
I'm not sure. I know they died quickly after 2001.
Yeah.
So, yep, Madden 2001. I don't know if there's a game I played with my buddies more than that one. So
it would have been on my NCAA football, which is basically like the same sports as the college version. That would have been mine, but I was in college by that point. So also
Masters of Doom by David Kushner. If you want to read
Masters of Doom.
It's a banger. Right. It's cool.
I'm gonna keep about those guys. I'm gonna keep in mind. Like the Dungeon of Doom. That's a wrestling thing. Different pod. Number 3 for me. I hope Jeremy can appreciate this one. 100% legit. Lots and lots and lots and lots of Knicks quarters went into this arcade game. 2-on-2 basketball, legendary game called NBA Jam. So many quotes.
Who knew you needed Who knew you needed a big head mode to really enjoy the game?
That was more. Did that even work on arcade though, or was that more?
That was on arcade. Yep.
It might have came more in tournament edition, but I can't remember.
Yeah, God, I remember that was so much fun, and we had like a high score thing, and just to be on the high score of that game was
who was your squad? Who was your squad?
I was trying to think of that earlier today, and I want to say it was Phoenix.
See, I always loved Supersonics, Detlef Schrempf and Sean Kemp. And then you had Gary Payton. He just swipe glove would just steal everything.
Yeah, the original only had 2 though, right? You could only play 2.
Yeah, it's 2 guys, but they had different two guy cycles.
Oh, you could alternate. Through. That's right.
There was 3 people you could.
Were good.
There was 3 guys, and you could switch who was the primary, who was the secondary. But
am I thinking right? Was it Rony Cycli played for somebody?
The Heat.
The Heat. Yeah. The Heat were good. Tim Hardaway, Rony Cycli, and was it Alonzo Mourning?
No, I think Glenn Rice.
The Glenn Rice nailing threes.
I think it was Alonzo, LJ, and Muggsy in Charlotte.
Oh,
Was there anything more frustrating than not being able to play as Michael Jordan?
Yeah, Chicago had Pippen and was it Kerr?
Yeah.
Kerr and Pippen. God. Oh, that's so much fun though. And the Timberwolves, like always, they sucked real bad.
Oh yeah.
I love how they'd have like the quick video intermission between like period. That's so dumb.
Because if you didn't go head to head, didn't you play like you went from like the weakest team on up? Yeah, I remember that. That was good times. So that was my number 3, NBA Jam, another sweet arcade game at the Carrington Youth Center.
Great choice. Still play it today on mine, man. I'll fire that up.
I should find it. Yeah.
My number 3 is this was right on the cusp. I think I was 17 when this came out. Tom Clancy's Splinter Cell. It was 02. Man, that game was sweet. Like I would like they had a lot of like it was less shoot 'em up and again like a little bit more cerebral approach, like go in, shoot out the lights, sneak by people, choke them out, you know. Yeah. So for the longest time I was like every room I'd walk into I was like, where are my exits? Where
where am I gonna hide a
window? Body? Yep. Could I put somebody behind that couch?
Okay.
It was like this mental check. No, it was a good game. And I don't know. I still I think those games still resonate with me today. So it's cool.
That's cool.
That's my number 3.
Yeah, I was a PlayStation guy, so like the Metal Gear games were a lot like that. I mean, just super fun.
Cool.
Those are great games. Yeah. Moving on to my number 2, but fun aside, there's a Super Nintendo game based on NBA Jam called Rap Jams, where the teams were rappers from the 90s. Look that one up.
I'll look
I
that
played
up.
as Onyx a lot. That was my team, if you're ever wondering.
Slam. They did a song called Slam.
Yeah, right. I was jamming all the time on those dudes. So that's a weird deep dive, but we played that game a lot, and it was identical to NBA Jam. So my number 2.
Yeah, go ahead.
Yeah, it was I think I mentioned before, when I was a kid, I really liked role-playing games. The JRPGs, as they call them nowadays, the Japanese role-playing games. Just because, again, having an older brother just kicking the crap out of you on anything that required skill made me hate those games. So I gravitated towards role-playing games because I could play them by myself and not feel bad about myself. And this game comes from 95. Absolute one of the best role-playing games of all time, I would say. It's a game called Chrono Trigger, put together by the same people that make Final Fantasy.
That's a deep cut, bro.
It's not a deep cut, actually.
It's not?
Super popular game. It was pretty cool. It used time travel.
Chrono Trigger?
Chrono Trigger. Yeah, look it up.
Chrono Trigger.
Chrono, yeah.
Chrono, like time.
Like CHR.
CHRONO, Trigger. The artwork was done by the Dragon Ball guy, so it kind of had that behind it. That was pretty cool. It was interesting. It had 12 different endings because you could travel through time, so you could finish the game in like 6 different time periods in a bunch of different ways. There was lots of different characters you could unlock, not unlock. There was a million side quests. So for the time, it was really cool. Like I said, 95. There's really no games doing that.
No.
And it still holds true, and it's kind of in this trademark hell right now between like 3 or 4 companies on who owns the rights to it. So there's never been like a great remake of it, and you don't see its IP in a lot of things, but just a banger game. Chrono Trigger, 1995.
Chrono Trigger. I've never heard of that before. You're deeper than me. My number 2 has been said on this pod already today.
Oh, snap.
In a sneaky way, in an aside. We got a PC back in like 91 or 92. I want to say it's like 92. And I was blessed to have this PC preloaded with this game, and it was Wolfenstein 3D.
Ooh.
And I played so much Wolfenstein, killed so many Nazis, including the super people. Nazi at the end.
They were bad people.
Found all the secret rooms, the secret doors, all that stuff. Just a blast of a game that would just suck me in till my mom would say, "Hey, time to go to bed. You got school tomorrow." But loved it. Literally embodied I was like a 6th grade version of that dude on South Park. They would show like chilling back. Yep.
Yeah.
I lived that life for a little while, and playing Wolfenstein 3D was my passion. So that's my number 2.
Just dusting them Cheetos off your tummy.
Yep.
Or did you stay up all night without Mountain Dew Code Red back then?
Just regular Mountain Dew.
They had it. It was called PK's Punch.
No,
I've heard that.
I didn't have PKs in Carrington. We had Coons.
I don't think anybody had PKs.
No, Montevideo and Canby. Well, yeah. My number 2, 2001. Again, a lot of these were like my later teenage years, I guess. The original Halo.
You're a Halo guy.
Yeah. And I thought, I was like going through it, like great storyline, but the big deal was the multiplayer, right? And in terms of, I was trying to think of it as like, the first big multiplayer that I had, but then I was like, GoldenEye, Mario Kart, N64, really Wave Race, like they did bring a lot of that stuff in, but I don't know, it's just like the graphics were so head and shoulders so much better than what GoldenEye was, right? Again, same thing, blocky guys. I mean, you got into the Xbox, and that was like kind of I would say the cusp of like the newer gen. PS3, Xbox. It was like kind of that shift.
I think you're right. I mean, the
so-
advancement from like, I mean, you know what you're talking about now, the games now, and I guess when I watch Connor play like Fortnite, I'm always like, ooh, that looks really nice, right?
Now I'm dizzy.
But think about like, you're talking about a game that came
Vestibular
out,
reflex.
you know, the Xbox One, the original Xbox came out in like 2001.
Yep.
So you're talking 21 years, and that graphic advancement's nice, but it's not like, it's nowhere near the advancement that we saw from like 91 to 2001.
Yeah,
that 10 years span.
Yeah, if you said from right when, I mean, what was SNES 90 or 91? But yeah, if you go from Nintendo, you know, from the end of Nintendo, you know, that decade, holy smokes, like every console was like, this is crazy, I gotta get this.
Yep.
So Sega Saturn, Dreamcast.
That's right. Yep.
Well,
Sega
nowadays, I mean, they'll release a game for the PS4 and the PS5. You know, it's like the same game, same system. You know, like you said, the graphics leaps just isn't that huge anymore. It's
and actually more
power, really.
You're right. It's load times, right? Like that's the big chunk of it. Wow, I don't want to wait for this to load up. You know,
I'm learning so much more. I'm going to bond with my son better because of my time with you guys.
Yep. And then he's going to say, I want an Xbox Series X.
He's all Switch. He's a Nintendo Switch boy. And everything's all about like, once a week, maybe other. It's like, oh, Nintendo V-Bucks purchase. And it's like, oh, I got a new skin, you know, for Fortnite or something. That's such a money suck. That's
microtransactions, man.
Yeah. Well, like, $10 to I can play Deadpool. It's like, okay. $10 more. I mean, you probably by this
never
point,
gonna get that back.
By this point, lifetime, he's probably invested $250 in Fortnite.
One game. But it was a free game.
Happy.
Yep.
All right,
you
Case.
can get Chrono Trigger's sequel, Chrono Cross, on the Switch if you'd like.
Ooh, I might ask him about that.
Bond over it. I don't think it's very popular. Chrono Cross was a PlayStation 1 game. They just re-released it. But my numero uno, another role-playing game, 1997, PlayStation 1, it'd be Final Fantasy 7. Just an absolute banger of a game. I think it was 3 discs.
Oh, really?
You know, at that time, just seemed crazy to have that many CDs for a game.
Seems crazy now.
Yeah. Just the amount of stuff on there. They had the cool cutscenes with like the pre-recorded visual 3D stuff that was really cool. This is one of the main reasons Squaresoft left Nintendo, because they couldn't fit all this stuff on cartridges, so they had to go to a different medium. Final Fantasy VII was originally developed for the 64, but it just wouldn't fit, so had to jump ship when Nintendo decided not to go to CDs, because famously PlayStation was gonna make Sony was supposed to do the next Sony 64, and they broke ways, and then they made the PlayStation 1 instead of the 64, and the rest is history that way. But this game's just awesome. Story's cool at the time. Like I said, the visuals were unbelievable. I put 50 hours into this sucker, and then my memory card got erased, which was devastating. So even though this game's top on my list, I've never finished it. I got to the last boss, and like RPGs then and now, there was a million side quests. I wanted to get them all done, and it deleted before I could finish them all. I had one boss to go.
So back when I bought a Xbox a year or two after it came out, and I went through a tear, bought some NCAA football games, had some Madden, and the storage space was so limited. And I'd like to go and rent games. You remember how you could rent could rent one of these games for like a week, 5 days, and just try to like hammer
5-day rentals.
And then you constantly run out of storage space though. It's like, now you got to go in and choose what you want to delete. You know, if you want to save your current game, it's just a racket.
I bought an aftermarket memory card that had like multiple, because originally for the PlayStation you had 15 blocks of memory on a memory card. And every game took at least one block. Final Fantasy probably took 3 or 4. So I bought one of these ones that had like 50 blocks of memory. Learned my lesson. Yeah. This game was super popular. Yeah, 13 million copies sold of the original one. So I mean,
never been a Final Fantasy guy, but I respect the lore that it's created.
Yeah, still plugging away. I think Final Fantasy Online's still one of the biggest online games that's been out forever. So cool game, great game if you like story and you don't want your brother kicking the crap out of you on something.
You just want to go into another little universe.
I sat in my bedroom, said FM.
I did not want to go to another universe for my number one. I wanted reality.
Let's go.
I was in the height of my teenage sportsdom. And again, I think about like my freshman, sophomore, junior year, my younger brother had gotten a Sega Genesis.
Ooh.
One of those years for Christmas. And I don't remember where my mom had the hookup with some used Genesis games, but within the bundle, she got like 4 or 5 from somebody for like a good deal. And within there it was Madden, and I fact checked this with my brother. I'm like, okay, we had to do some producing. Which Madden was it? It was 95, Madden 95. And I played my ass off on that. And Jeremy, when you're talking about like the graphic distinctions, stuff like that, Casey, the movement to the Xbox. But at the time, it felt so good. It was like I was used to play Tecmo Bowl, which I love Tecmo Bowl. I've said that before. But once you started playing Madden and you had more than 4 plays to choose from, and you could set different formations. My goodness, I played hours and hours of that. Again, kind of like that same thing. I always think of winter when I was playing these games, like wrestling season, or sometimes like a Thursday night, chilling, like, come home and you just can't. You're not going to go out with your buddies and tear one off before a football game. You kind of play it smart, and that's what I mean. At least we did that for the most part during the season. It was like you gotta mind your P's and Q's and then let it rip once you're done for the year. But that's my number one, Madden 95 for the Sega Genesis.
How many people were on a team in that? Wasn't 11-man teams, or was it?
Yep, it was 11.
Yeah, it was full.
And it had real players. Cool. I mean, it had real teams, real players. So that sucked me right into it. And you could, I think you had to leave it on though, in order to like go through a season.
Really?
Yeah.
Oh, yeah. That's wild. I know people always say NHL was a more popular sports game on the Sega, but I remember Madden being a big game.
Well, and I actually liked NBA Live 95 too. NBA Live and NHL Live were both really fun. NHL Live was so unrealistic when you talk about sports games. Like you could score 13 to 15 goals in every single game, but it was fun.
You could beat the crap out of each other in that one, right?
Maybe. Yeah,
because I think that was a big distinction between the Super and Sega NHLs was you could fight on the Sega one. And I don't think you could on the Super one.
Those badass Sega folks.
Right?
Yeah.
We talked about that with Mortal Kombat.
Yep. Yeah, man, the Sega had some bangers. Yeah, just you and your Mountain Dew on one side, Raccoon on the other, just playing some NFL. I like it.
Waiting to get that pelt skinned. Yes. Jeremy.
Right.
Finish the sucker with your number one.
My number one, we're back to Zelda. It was the sequel to Ocarina of Time, Majora's Mask. Came out in 2000.
I never knew this about you.
Yeah, man. Zelda was the bee's knees, man. In terms of like, it was like a little bit of a darker storyline. The moon was going to come hit the earth. So you kind of always had this like couple of days that you could move through. And so you're kind of shifting through time a little bit, and
like a Chrono Trigger almost.
The cool thing about this, I had to produce this. We're talking about the difference between an N64 to like a Xbox Series X.
Yeah.
So the cool thing about Majora's Mask, you had to have the expansion pack for N64. I don't know if you remember that.
It was the only way to play Turok.
We're hearing about Turok. That's right.
Only way to get rid of the fog.
This increased the RAM from 4 megabytes to 8 megabytes.
Double.
The Xbox Series X has 16 gigs of RAM. So your high tech was 8 megabytes to 16 gigs. It's nuts.
Yeah.
Amazing what they could do, actually.
So that's over the course of 20 years right there,
Yep.
22 years. So, yeah. And
That's pretty cool.
now we're all going to be integrated in the metaverse and whatever,
You said we're in the Matrix already.
Yeah.
Yeah, how much RAM you think we're running on this thing?
We've got great graphics.
Very believable. Very believable.
We're all in VR in our little battery pods.
That's awesome.
Put me back in the goo.
Yeah.
Yeah.
Let me be. I was enjoying my VR within my VR.
I mean,
tell my wife.
I feel like I learned a lot tonight. I
Yeah.
learned an awful lot about vestibular stuff. Learned an awful lot about you two guys with your video game. I don't think we had any overlaps, did we?
Nope.
That surprises me. Yep.
That's a big list, though. That's a lot of games to go through.
I thought somebody else would play NBA Jam.
Well, like you said, game. Oh yeah, that. I mean, if I was saying on SNES, NBA Jam, Street Fighter 2.
I thought about Street Fighter 2. Yeah.
My goodness, that was good. And then PC games, Age of Empires. I was a big Age of Empires guy growing up. Start your colony, go through the historical timeline.
Yeah. A guy like you must love Wolfenstein.
Yeah, that was a good game. That was a good game. Yeah.
Get those freaking
I played a lot of Civ 3, Civ 2, Civ 3 in that age period. Played a lot of that on the computer.
You'd open up to the main bad guy and he'd be carrying 2 miniguns and he's like, "Guten Tag."
I had Wolfenstein I think it was called The New Order. That came out 10 years ago. That was a good game too. But yeah.
Oh, good stuff, boys.
Well, that was good. That concludes episode 35 of BT Shop Talk. As always, questions, hit us up on Facebook, leave those comments on the posts. Want us to talk about anything in specific, want some top fives from us, hit us up at ptshoptalk@gmail.com. Check us out on YouTube. Videos posted regularly. I would say I'm back at it now. I was a little sloppy there for a couple weeks, so I apologize, but we are up to date on YouTube. Follow us on Twitter, although I don't do much on there, but I would try to be better if people would follow us. So until next time, I'm Casey Hatzett. With me as always is Nick Doling and Jeremy Van Klompenberg. Thank you, everybody.
Peace.